When you think about a doctor's job, you probably think about diagnosing illnesses or performing surgery. But some of the biggest challenges they face, well, they're not medical, they're ethical. So today, we're going to pull back the curtain on something called Bioethics Grand Rounds. It's a super important part of their training, and we're going to figure out exactly how it works and why it matters so much.
All right, so let's set the scene here. Imagine a bunch of medical residents, doctors in training, getting ready for their monthly Bioethics Grand Rounds. And I want to be clear, this isn't just some boring meeting or a box they have to check off. No way. This is a really fundamental piece of their education, something that's literally shaping the kind of doctors they're going to be for the rest of their careers.
So that brings up the big question, right? What's the point of all this? What are they actually trying to achieve with these grand rounds? And how in the world do you even prepare for a discussion that's so complex? Let's dive in and break it all down. Okay, so here's our game plan. We're going to look at this in 5 parts. First, the hypothetical case. Then we'll get into the 4 core goals. After that, we'll see how they prepare the protocol, what the actual grand rounds event is like, and finally, who's in the room for these important talks.
All right, first things first, the hypothetical case. And you'll see pretty quickly that the real focus here is on protecting privacy and, just as importantly, on the process itself.
Now, this is absolutely crucial. The #1 priority here is confidentiality. So we're not talking about specific, real patients. The details of any case are changed so much that, honestly, it often becomes completely hypothetical. The whole point is to make sure patient anonymity is 100% protected.
And that leads to the real takeaway here. The goal isn't to solve one specific medical puzzle. It's about building a kind of ethical toolkit, a skill set that doctors can use again and again. This is all about training them on how to think through and navigate the ethical minefields they're bound to face in their careers. Okay, so if it's all about training, what are they actually training for? What are the skills they're trying to build? Well, the why behind all of this really boils down to 4 main goals, and they go way beyond just the medical textbooks.
Yep, there are 4 of them. 4 core pillars that these grand rounds are built on, and each one is designed to help shape a more well-rounded, a more complete physician.
So what are they? First, it's about enhancing the humane side of being a doctor, building empathy. Second, it's about getting better at communication, which is so important. Third is all about raising awareness of the different ethical issues and principles that might come up. And last but not least, it's about developing a real practical system for analyzing and working through these tough ethical problems.
So, we've got the why down. Now let's talk about the how. How do these residents and the hospital staff actually get ready for a discussion that needs to be this focused and this productive?
Well, it's a really collaborative step-by-step process. It starts with the residents who draft up a case protocol. Then they take that to the Bioethics Committee. The committee's job is to help them narrow things down and focus the discussion on the most important parts. And they even have a library residents can use to dig deeper and do their research.
Okay, so all the prep work is done, the groundwork has been laid. So what happens next? What does the actual Grand Rounds event look like? This is where all that theory gets put into practice.
It's this really cool mix of structured and dynamic. You have a moderator who gets the ball rolling, then the residents get up and present their findings and their ethical assessment. After that, you have invited experts who offer their own commentary. But, and this is a big but, it's not just a lecture. The audience is highly encouraged to jump in, ask questions, and participate. It becomes a real conversation.
And this quote really gets to the heart of it. The whole idea is to resolve these tough questions before they ever have to see a courtroom. It's about finding solutions and a path forward within the medical community itself, not getting bogged down in legal battles.
One of the biggest strengths of these rounds is just the sheer variety of people in the room. You get so many different perspectives. So let's ask, who exactly are these key voices that all come together for this discussion?
Okay, this is where it gets really interesting. Of course, you've got the moderator and the residents who are presenting, but then you also bring in a medical specialist, a bioethicist, sometimes even a lawyer if it's relevant. You could also have a hospital administrator there or a patient advocate. It's this whole mix of people that makes sure the problem is looked at from every single angle you can think of.
So, what's the big takeaway from all this? Why does this whole process matter so much? Well, because it's not just some abstract academic exercise. This is a vital training ground. It's what helps build doctors who are more humane, who are better communicators, and who are just more ethically aware in every single decision they make.
And that really leaves us with something to think about, doesn't it? In a world where medical technology is advancing at lightning speed, how crucial are these kinds of structured, very human conversations for making sure we always keep the care in healthcare?